Hi, I'm Dr. Manor Haas. I'm an endodontist from Toronto, Canada, and I sincerely hope that this video finds you, your loved ones, your staff, your patients in good health during these unprecedented times of the COVID-19 virus. This is a very fluid situation, and we need to stay on top of it day by day as things progress. But in the meantime, for us wet finger dentists, the ones that still we have an obligation to look after our patients, whether it be in person or by phone, we need to figure out a few things and how to manage emergencies and who do we see. It's become crystal clear now in the United States and in Canada that governments have said that we should only provide essential services when it comes to dentistry. So non-essential services, period, we should stop immediately. That being said, from an endodontic point of view, what's considered to be an emergency? We need to know that. We need to sort of triage patients, whether it be in person when they show up to you or over the phone if you're not in your practice or before you even have them come into your practice. It's extremely important to triage them before they even come into your office. You should screen your patients very carefully over the phone. Need to ask them the routine questions about if they've been sort of out of the country, if they've got any signs or symptoms related to COVID-19, because otherwise if you bring them in, and especially if they come in potentially for unnecessary treatments, for something that's not considered an acute emergency situation, then you're putting your staff, yourself, your patients at risk unnecessarily. So we need to really be able to triage and sort of weed out the significant and non-significant essential services and emergencies. From an endodontic point of view, it boils to what's an endodontic emergency? Who should we see? How do we figure that out? It's a bit of a gray thing. It's not like mathematics where 2 and 2 equals 4 and there's such a clear-cut scenario for it is an emergency or it's not. So you have to gauge it case by case. But that being said, if your patient, for instance, calls you and they're saying that, they've been in pain for the last several weeks and it's just mild to moderate, it's probably not an acute emergency. You may want to consider not seeing them. If on the other hand, they tell you that they've had acute pain, severe pain, they've stayed up all night, they can't drink cold, hot, or bite that area as acute pain, then in that case, you need to consider that as an emergency, as a very likely a valid emergency that you need to somehow manage, whether it's yourself or refer to a clinic that can look after them safely during these times. If they have a space infection, if they're coming in, they actually have a space infection, that's an emergency. You need to ask them over the phone. Very often patients say, oh yeah, I have a swelling. Ask them to look in the mirror. If one side looks puffier than the other, it's probably an emergency. Now that doesn't automatically mean that you need to treat that or can treat that. On the other hand, if they say, no, it's not necessarily different, when looking in the mirror, it looks pretty much the same and symmetrical, then maybe it's not an acute swelling. If it's just a little fistula that they have and it's draining, a little localized fistula near the compromised tooth, again, maybe it's not an acute emergency. They may be asymptomatic or mildly symptomatic, and so long as it's draining, you may or may not need to see them, or you might be able to provide them at least antibiotics for the meantime, and then sort of take it from there and see how the situation pans out with the COVID-19. But one thing we need to keep in mind is when it comes to managing patients, we need to keep in mind the risk that procedure puts us and other patients and our staff at. In other words, we need to really minimize, if not eliminate, the production of any contaminated aerosols. So if you have to provide an emergency procedure where now you're going to be using a high-speed handpiece or an ultrasonic, and it's now going to be used alongside patient's blood, saliva, and it's going to produce aerosols, either you have to absolutely try and avoid that procedure altogether by giving over-the-counter medications or antibiotics, or sending them to a clinic that is suited and prepared to treat such cases with proper protections, or you can't see them yourself. So it is extremely important. Now, from an endodontic point of view, it's a good thing that we're using rubber dam isolation, because the use of rubber dam isolation, from the moment that you actually give them anesthesia, in other words, from the moment that the rubber dam is on, then you do the access, you're pretty much protected from contaminated aerosols. So even if you're using a high-speed handpiece, so long as there's rubber dam on for the entire procedure, including the endodontic access, then you're not going to be producing contaminated aerosols. Keep in mind, if the patient has an emergency and the treatment is performing an apicoectomy, let's say, I would really strongly encourage you to try all means to avoid that, because in those cases you will be producing contaminated aerosols. When you're doing your osteotomy, when you're using an ultrasonic, you've got blood, saliva potentially, contaminations, and now you've got aerosols. If a patient absolutely has to be treated and you will be producing aerosols that are contaminated, you need to keep in mind, are you protected, or is the facility and the staff and the other patients protected from that? In other words, are you using a face shield, N95 masks, disposable gowns, on and on, those sort of things. So, in terms of the guidelines, even that's sort of fluid. So make sure to daily check all these important resources that we have available to us. In the United States, something, for instance, such as the Centers for Disease Control. In Canada, refer to Health Canada. Go onto the websites for your local, state, provincial, dental jurisdiction or licensing bodies. Stay up to date. But there's a lot that you can do in triage over the phone, try and figure out, is it a true emergency or not? You know your patients. To some people, minimal pain and life is over. Well, you know what, maybe you need to weed those out. On the other hand, some patients that you may know very well, they never complain. So when they do complain, and it's acute pain, and it cannot be managed by over-the-counter medications or antibiotics, then in those cases, you have to try and manage them. You have to somehow find them a clinic, whether it's yours or another clinic in your area, that could look after them. So it's really important to try and triage what is an endodontic emergency, what's not an endodontic emergency, and use all the precautions that you and your staff can. It is so important. Screen your patients over the phone. Screen them when they walk into the office. Immediately as they walk into the office, before they go to the common area, make sure that they're screened. It's extremely, extremely important. And then just follow all the regular protocols. I mean, what we've been doing for years with universal precautions, but just taking it a notch up. Remind your staff, wash your hands 1,000,000 times. Washing hands have been shown to be more effective than using even sanitizers. Wash your hands, your staff's hands 1,000,000 times. Don't touch countertops. Wipe everything. Wipe everything in the office, not just the operatory, and not only sterilizing the instruments, but wipe the common areas. Wipe all door handles, the common washroom, the seat. I mean, we just need to be as safe as possible without panicking. We will get through this, but we just need to be smart about this. And doing all this puts everyone at ease. I find that a lot of practices, a lot of practitioners are sort of stressed, understandably. Their staff, our staff, potentially are stressed. These are trying times. It's really nice to take a leadership role, if you can, as the doctor, and reassuring your staff what's going on. We'll get through this. You're there for them. Even though there's some things we may or may not know in terms of what's going on and how it'll proceed, but just be there for them. And the more facts your staff know and your patients know, the less fear there is. There's a lot of fear when they don't know what's going on. So the more facts, the less fear. Reassure them, follow proper precautions, and do your best to triage patients and only look after essential cases. So I sincerely wish you well, you, your loved ones, your family, your dental team, and your patients. We will get through this, but I sincerely wish everyone well. All the best to you. Bye-bye now.